Hi everyone, welcome back to my channel. Canada has a publicly funded free healthcare system in place, which means majority of the healthcare services that you want to avail are free of cost and are funded by the government. In order to access this free healthcare system, you need to have something called as health card. This health card is one of the most important documents that you need to have as soon as you land in Canada. Depending on province you're living, let's say for example you're living in Ontario, you need to go to Service Ontario and apply for the health card. Even though it covers majority of healthcare services, there are some aspects which the health card or the health insurance plans funded by the government does not include. Let's look at first what all it includes. The doctor appointments or doctor visits, diagnostics tests, which is basically x-rays, blood tests, etc., whatever tests you want to go for, everything is covered. You don't have to pay. It includes hospital stays. Let's say if you're going for surgeries or any other, it's just that it does not provide you private or semi-private rooms. It most basically provides you general ward. It also includes all the surgeries that you need to go. All sounds good, but the health card does not cover everything. So here are the list of things that health card doesn't include, for which you need to pay money from your own pocket. First thing is the prescription drugs. Yes, that's the biggest factor. So once you visit your doctor, if your doctor gives you a prescription, in order to get those drugs, you need to pay money from your end. The other things that the health card does not include are your dental care, your vision care, your extended medical services such as physiotherapy or massage therapy, anything that you might need. Also, the health card does not provide you with a private or a semi-private room in case where you have to get admitted to a hospital. In order to overcome this limitation, that is where you need to have a private medical insurance. Of course, everyone is eligible to apply for a health card, but there are certain limitations with respect to province to province. For example, in Ontario, students with a student work permit and their dependencies are not eligible to apply for OHIP. OHIP is basically the Ontario Health Insurance Plan. And in some other provinces, students who are staying for more than 6 months of duration are eligible for their provincial health insurance plan. How to get this health card is very simple process. Let's say if you're in Ontario, you have to go to Service Ontario. There are these are government offices. Find the nearest one and apply for a health card there. Now, what are the benefits of insurance over the health card? Like I said, health card has certain limitations which is covered by the private health insurance. Your employer most likely provides you with one insurance plan. So this policy covers pretty much, it covers for all three of us, and it pretty much covers all the services we need. Prescription drugs, your dental care, your eye vision care, your other extended healthcare services as well. Dental expenses here are very expensive. You check out this video. Thanks to the health card and the insurance policy, out of $1,500 bill, I only paid $1 for everything. Now, next comes the biggest question: how do you find a doctor in Canada? Trust me, this is one of the biggest and most challenging part of your stay in Canada, because finding a doctor is not so easy. So there are 3 steps. The first is, of course, the ideal one is if you have your family doctor. But finding family doctor is really difficult, because wherever you call, wherever doctor you reach out to, they will say that we don't have vacancy. If you don't have family doctor, the next option you have is actually going with a walk-in clinic. So there are multiple walk-in clinics in Canada where you can actually walk in. The doctors there won't appreciate or won't, if you don't have something like, you're really not in need of a doctor. And the third option you have, of course, is you know that is a 911, which is basically for the emergency purposes only. Please use 911 judiciously, because that is something very dedicated for only emergency cases. Having said this, here is my biggest recommendation to you. If you are someone who is in the plans of moving to Canada, I would highly recommend you that bring a basic set of medicines. At least for the basic things, you will be able to treat yourself at the home. And this is especially true if you have children. So that's all about the healthcare systems in Canada. I hope you liked this video, and if you did, please give it a like and consider subscribing to my channel. Thank you so much and have a nice day.